Hi, Rajan. We are
Hi.
um, we are looking forward for your upcoming visit next month. Um, I have a question which comes from one of the participant in the wellness workshop, which is being led by you on 23rd of February. That there is so much talk about wellness. What is this wellness? And the experience?
Well,
Yeah.
yeah. So the wellness is the experience of a set of effects in the human body and mind, as opposed to the disease experience. It's a spectrum. So on the one hand, on the left hand, you can say we have the wellness experience, and that gradually decays into the disease experience, of which there are like 6 stages. So wellness itself is an experience at many levels. It's at the level of our physical body, at the mental level, at the emotional level. And there are 7 aspects of attention that form the matrix of what wellness would feel like. The first is, of course, nutritional competence, eating the right kind of food for your genetics. The second is a balanced metabolism. How do you maintain that and sustain that? Third would be peace of mind. How do you ensure that you're not challenged by excessive stress? Immune competence. How do you ensure that your immunity is sustained at a competent level? Appropriate exercise for your genetic or biological profile. Sleep nutrition. How do you ensure that you're getting adequate sleep? And lastly, the experience of joy and how that impacts on our experience of wellness. So wellness is more than just not experiencing disease. It's a very positive set of attributes that we can, in fact, know experientially. How to do that is a skill. And so we'll be sharing some of those skills in terms of how people can put together little interventions that change their lifestyle, diet, and other factors leading to the experience of wellness.